absolute honor and joy to be sitting down with one of my closest friends and my probably favorite practitioner of all time, Dr. Robert Kachko. I can't believe you're here today.
That's a lot of pressure, Michelle.
Yeah. The goal is to put a tremendous amount of pressure on you and squeeze as much information out of you as we can.
We'll see what happens.
Exactly. So I have told our friendship story, our, let's call it a hero arc of our...
Also a lot of pressure for you this time, though.
Exactly. Of how we came from literally being in a doctor-patient relationship and now ending up being super close friends and I would say best friends, and also having a tremendous amount of collaboration in the work that we're doing and the work that we do with clients. So I'm going to call you Rob or Dr. Kachko throughout. I went to Dr. Kachko because during the time I was a patient, this was during my anxiety part of my journey when I had, already implemented a lot of things to help myself. And I would say I was about 70 to 80% better from the interventions I put into place, and came to you and really took me to that, finish line, so to speak. And in our first session, which was a 90-minute session, what are we talking, 8 years ago or something like that? I was the first time that the light bulbs went off in my head and I was like, oh, this is what coaching is. This is what medicine is. And felt like I understood for the first time what I wanted to turn my career into as a dietitian. And you are, of course, you'll have heard from the introduction before, you are a naturopathic physician. So we're going to talk about what naturopathic medicine is, but so much of my healing journey and my practice is dependent on the work that you've done and our friendship. So just thank you for that.
Well, thank you for coming in that day and for forcing me to be your friend.
Exactly. Yeah, that was really the more of what happened is I was like, oh, it's so weird that you think you're my doctor because we're best friends and business partners. Yep. And we ultimately ended up making an 8-week online program, Anxiety Proof, to help people reverse panic attacks and anxiety. We're definitely going to talk about that and a little trauma, a little stress, a little anxiety, and really some tangible strategies for people today. So welcome. That was a very long introduction. How you doing?
Thank you for having me. I'm good. I'm just enjoying listening
to your own story of your life.
Talk about me, Michelle.
Tell me more. Exactly. So recently, you have shifted your naturopathic practice to kind of incorporate a really trauma-informed lens into your business. Can we talk about what led you to this shift? And then we're going to walk it back to naturopathic medicine on a general level. But I want to talk about a little bit about what that shift was for you.
Yeah, well, I think in a word, frustration, because you go through naturopathic medical school and basically for people who aren't familiar with naturopathic medicine, we're talking about holistic primary care. It's about taking a comprehensive view of a person's health, and in practice, you really want to help people and you use all the tools you can. And I had this issue, especially early on in practice, where I tried to do too much. And I was putting them on all these protocols, dietary recommendations, lifestyle changes, helping them with stress. And people got better. People got 50% better. They got 70% better. Some people didn't get better at all. Some people got 100% better. But what I found was the people who struggled to find full, sustainable, vibrant health had something else going on. And so it required asking the right questions. It required asking about the environment within which people lived, where they went back to. You've heard me say this phrase that it's hard to heal within the environment within which you got sick. And so if you've got, just a couple of days ago, I had a mom of 4 who just doesn't have time to take care of herself. She has early childhood trauma. She has trauma from past relationships. And then in this moment, she doesn't have the space to take care of herself. So I started understanding that I can make all the best recommendations possible. She can make all those changes. As you know, she can make dietary changes for a month or 2 months. And then life goes back to normal, goes back to that baseline. And so I got more interested in resetting that baseline. And in my experience, we have to consider 3 factors to do that. We have to consider the person's biology, right? That's nutrition, that's lifestyle, that's the biochemistry and the physiology. We have to consider their ecology, that's that environment I was talking about. What are their relationships like? What exposure do they have to environmental toxicants? But the most important piece that I found was we have to consider their biography. What happened to them? What was the story of their life? What was the narrative arc of their lives? And when I started asking people these questions, it was just impossible to ignore that pillar of long-term sustainable health. So that sent me on a journey to do all kinds of trauma-informed training, SomaticExperiencing, which we can talk about, hypnotherapy. We use acupuncture in a very trauma-informed way. And of course, all kinds of counseling and things like that. And what we try to impart on patients now in our clinics is that we have to address both. We have to walk both paths, right? First of all, they're coming in not for therapy, they're coming in to see a doctor.
Sure.
And so they want to address the physical causes of their challenges, but we also help them understand that we have to address that what happened to you challenge, whether it's big T, capital T trauma, or sort of the smaller stressors that happen throughout a person's life.
And I think, when I think of functional medicine or I think of naturopathic medicine, one of the first things that comes up is this idea of like the timeline of someone's health, right? The story behind their health. So it does feel really challenging to support or treat a person without understanding their biography. That, like, exactly like you said, I think that's like an essential part of functional medicine that's often missed recently. I think people are really more into like, hey, what supplements can I give you? How can I inject you with something cool, a cool new cutting edge drug? But the missing element is really that biography piece. And for you, it felt like you were able to incorporate that biography, but now using a trauma informed lens, does it feel like you can add more support to that too with what you're learning?
Yeah, so both approaches, they potentiate each other. The reason most, whether they're holistic providers or conventional providers, we can call it functional, naturopathic, integrative, whatever you want to call it, the reason we tend towards things like vitamins and injections and IVs and all that kind of fancy stuff is that it's much more direct. It's in many ways, it's still complex, but it's much more linear. It's much more understandable. And it's also much more marketable because who really wants to face their pain, right? And so that is something I think that's missing in that world. But again, I would offer you have to do both. And so, yes, let's just take an example. I think that'll paint the picture more. Someone comes in with irritable bowel syndrome, IBS. 80% of people dealing with IBS, first of all, you have to rule out all the other true causes, right? It's a diagnosis of exclusion. Most of the other factors are not excluded often. But we have to work on their gut. And if we can get them to be less anxious and to sleep better and to face their trauma, their healing is potentiated. Their gut healing is potentiated. We could talk about mechanisms and how that happens and why that happens. But the bottom line is, if we look at the statistics with IBS, let's just use that example again, 85% of people dealing with true IBS, when everything else is excluded, have dealt with some form of early childhood trauma. And so we're ignoring this whole subset, the majority of that population, if all we're doing is saying, well, we're going to send you for a SIBO test, and you know what, everything else doesn't work, we're going to put you on an antidepressant. There's an understanding there that the mental health component is valuable, but that's just an insufficient, you're bringing the wrong tool to that
fight
challenge.
Or whatever it is, yeah. Would you say that it is this is like a hard theoretical question, but would you say it's impossible to heal without facing the trauma, either big T or, stressor element of your life?
I wouldn't say impossible because that feels disempowering for people.
Good.
I think that what's important is understanding, first of all, how we define healing is our first step in that, right? What's the operative definition of healing? For a lot of people, it's being symptom-free. But if true healing is feeling connected to purpose and feeling connected to the people in our lives and feeling pain-free and not having the symptoms and feeling like you wake up every morning with vibrant energy, I do think that it would be necessary to face those things. That said, our body, our nervous system tends to heal sort of by example. Examples of, let's call it safety. When the body feels safe enough to move forward, that healing happens. It's not in the therapy session or in a session doing trauma work. It happens in every single moment in your life when you feel supported and you feel like you have what you need. So in healing up someone's digestive issues, in finding the root cause and discovering that physical challenge, true healing can happen because the nervous system takes that and says, okay, we can be safe. That thing that I've learned to do to protect myself, and let's talk a little bit about what I mean by that, that's gotten me this far, and maybe I learned to do when I was 12 years old and I had a disordered eating pattern or whatever else, that thing no longer serves me because I know what it feels like to feel okay now. And so you can heal in that way as well. So it's not that you have to go do the very difficult work of facing your pain from your past life experiences, but again, it certainly potentiates the work.
And do you think that because there's something in what you said that I want to elaborate on. Do you think that there's a way that stress becomes like a state of stress becomes a new norm for people? So that also becomes hard on a neurological level, a nervous system level, and also in like just our behavior level. Do you think that happens?
Yeah, in many ways. We have sort of different physiologic set points. So the most probably direct way is to describe sympathetic and parasympathetic balance. People have heard of the autonomic nervous system, also considered the automatic nervous system. These are processes that are always happening sort of at odds with each other. We're always somewhere on this balance of full sympathetic being fight or flight. People have heard of it that way more. Or parasympathetic, people hear about it as rest, digest. Basically, physiologic function happening the way it needs to when we're not focusing on running away from, I think you like bears, right? That's the example you like to use. Running away from a bear. When that happens for long enough, and again, either an extreme trauma that we don't have the resources in the moment to deal with, and we're stuck in a state of what's called tonic immobility. Again, we can talk about that, but in extreme situations or chronic stressors throughout life, our physiologic set point changes. As a result of that, our hormonal pattern changes, our production of things like cortisol and our thyroid production, all of our sex hormones, estrogen, progesterone, and men testosterone will plummet when that happens. Our inflammatory cascades change as a result of that. Our neurotransmitters, much more quick acting, but always often secondary to these hormonal changes, also will find a new set point. And so what ends up when a person goes to a psychiatrist's office as what looks like a serotonin or a dopamine deficiency had about 4 layers before that. And so the body quite literally changes. And in many ways, and again, I don't want to use this as a disempowering phrase, gets stuck in that experience and in that trauma.
And yeah, we'll call it gets temporarily stuck or whatever, because it can be moved out of too. But it seems like when you're in that stage, it's easier to stay in that stage than to move out of it. Is what it sounds like. It feels harder or not as natural to move out of it. So that stress becomes a new norm kind of for people.
Yeah, I mean, these are survival mechanisms, right? The body that survives an extreme experience, an extreme event, and the key word there is survives that experience, learns how to be in order to keep surviving in life. And so that experience is then applied through a different lens to everything that happens in the modern world. And so if we take like a evolutionary biological lens, that bear is chasing us in the woods. Well, now I'm at work and my boss is yelling at me, or my spouse and I are not having conversations that serve us very well. Absolutely, those same mechanisms are turned on. And so the fact that we survived and the fact that we got, again, hopefully temporarily stuck in that experience, means that the only way through it is to, unfortunately, and that's what makes it hard, to re-experience that trauma, but in an accessible way, in a safe way, in a tolerable way for the nervous system so that it doesn't overwhelm us a second time. And people use this term re-traumatize. That's certainly not something that we're looking for.
And I think that in the current model of treatment that I see mostly in modern medicine, we talked about one modality, which is medication treatment. Mm-hmm. You said something I want to go back to because it was important. You said by the time something looks like a dopamine or a serotonin deficiency and you're given medication, there's already been a biological process going on for a bit. Can we talk about what that looks like that leads to that, level of either, symptoms of depression or what doctors would say is a chemical imbalance, quote unquote?
Yeah. So what manifests as a change in neurotransmitters is usually a function of something else that's misaligned with the body's needs, right? Those needs could have changed because of some past experiences. Those needs can be unique to that individual because of genetics. But the fact is, in that moment when they come into your office, they have very specific needs. We talk about the root cause, right? So maybe there is a deficiency in certain cofactors, so vitamin and mineral cofactors that the body needs to convert that, say, let's just take serotonin, that tryptophan that we get from turkey, which everyone loves, into serotonin and then downstream melatonin. So it could be something as simple as that deficiency. It could also be that our brain is chronically flooded with that cortisol, that stress hormone. When that's happening, that step that converts is just turned off. Same thing happens when we're chronically inflamed. All the reasons why a body can be chronically inflamed, from environmental toxicants, sort of man-made chemicals that we've been exposed to again, stress and trauma, to lack of sleep, to sedentary lifestyle. So all of those root causes, antecedent causes a response in the body, turning off an enzyme. For some reason, we don't always fully understand why that's happening, but the enzyme is impacted to consequence. The consequence then becomes suffering to some degree. When we look at it from a reductionist lens and say that the challenge is a serotonin deficiency, or frankly an SSRI deficiency, we're missing that whole, I guess we can call it an iceberg beneath the water, all those other layers that are contributing. Because what we do when we only look at that consequence, when we look at that end result, is we forget about the fact that the body, again, is always working to keep us safe. It has an innate capacity for healing that is disrupted by all these factors that we've talked about. But if we're working with the physiology, we're not trying to turn off those symptoms that the body's feeling. We're trying to support the physiology so that it can heal itself, because no medication heals, no healthcare provider heals. The person has to do the work themselves.
Exactly. Which, by the way, stinks. I wish we could do it for our clients
magic
and patients,
pill.
right? Yeah, I would love that. I would love if like the model of medicine that we see actually was the one that you could give someone a pill and it would cause healing. I would like love that. That'd be awesome.
Yeah.
So one kind of mode of treatment that we see that's pretty common for people is medication. And you and I are both like, you have to do what works for you and work with your provider. Like there's not an ounce of judgment here at all. Another mode of supporting anxiety that I see, of course, people engaging in is going for talk therapy with therapists. Where do you find talk therapy super supportive for people? And then where do you think people might need additional support if they don't feel like they're seeing progress in talk therapy?
Yeah. Honestly, most people need both. Talk therapy, psychotherapy, CBT, ACT, whatever approach you're using, is very helpful to discover patterns, to discover and understand this thing happened to me, and this is how it's manifesting today. What talk therapy doesn't do is speak to the way trauma impacts our physical body. And so it's worth talking a little bit about the difference between explicit and implicit memory. Explicit memory is what we can use language to describe. Okay, I remember this thing happened when I was 5 years old, and it happened because my father did this or my mother did this, and now I feel this way. Implicit memory is beneath language. It's beneath conscious awareness. And it's what happens when, well, first of all, it happens all the time and our brains do it. But when it happens in a clinically relevant sense, it happens when there's a lot of intensity to the event. Think about a car accident or some kind of physical abuse. We store these memories in a very implicit way that is not available for conscious awareness. And there's a lot of research from forensics to psychology research that says that people's memory of an event is not very accurate if it happened with more intensity. And it's almost a linear sort of response that way. And so what we're asking people to do is come into their therapist's office, and certainly a good therapist will pull out what's important and help people remember in the right way. But we're asking them to talk about an event that is beneath language. It's beneath conscious awareness, like I said. And so those are the types of things, to bring it back to the medical side of things, that manifest in physical symptoms as well. Right? Because we can talk about anxiety as a symptom, but let's talk about joint pain, or let's talk about migraines, or that IBS that we spoke about earlier. The deeper, more implicit memory, when it's impacted, and again, is quite literally bringing us to be stuck in that moment, that is what manifests in physical symptoms. So what I would offer is most people these days, unfortunately, probably need talk therapy, and they need to be doing work that focuses on how their body is experiencing those experiences.
I think that another concern I have with people only choosing one route or the other is, of course, like ignoring the physical for the mental or ignoring the mental for the physical. If people have a substantial amount of trauma and they're not aware of it, is there, of course, like any licensed therapist is, I'm sure qualified to support that. But is there something to be said for like talking something and like pulling something up and then not knowing how to process it on a physical plane? Like, does that ever happen in talk therapy?
Well, let's talk about, first of all, in talk therapy. And again, I'm not bad-mouthing
we
talk therapy.
Freaking love talk therapists.
It's helped me, right?
Yeah, exactly.
It's helped all of us.
We love
and I'm often,
CBT and DBT.
I'm usually referring out, but those questions aren't even asked.
Right.
So what's happening in a typical therapy session is, again, it's all up here, and the conversation is, okay, X, Y, and Z happened, but it's not, when I think about X, my heart is racing.
Right.
My stomach is
somatic,
turning.
right? Yeah.
It's being ignored. And so what I would offer is that's actually, in some ways, solidifying the experience. Right. If you're doing both, that doesn't tend to happen as much.
And it's my understanding that it's almost part of somatic experiencing or EMDR is of course, we've done sessions together for literal recreation and fun, and because they were super supportive to me. But part of it is also you're walking through an experience during that and intentionally noticing things and noticing how you're feeling. So if you're just talking through something, you might, like you said, not be connecting the mind and the body. And I know this is a spoiler alert. I know about you that the most important thing always in all of medicine and your practices is connecting the body and the mind. That seems to be like if I were to say like the Kachko thing, it's like the mind and the body are super duper connected.
And I would even take it a step beyond the mind-body connection, which is often written about. You read it, WebMD articles. I would phrase it from the perspective of mind-body reintegration. That we start out as a whole being, and then we lose that along the way. And we can take a spiritual lens on that, and we can take a more of a sort of cognitive lens on that. But the truth is, what we're doing is bringing people back to their baseline, and their baseline is understanding and being connected to their body. Look at the typical 3-year-old who's always in their feelings, right, in their sensations. We lose that. We're taught to lose that because we're taught to just be very linear and cognitive. And so this concept of mind-body integration or mind-body reintegration has always resonated with me a little bit more strongly.
And one of the tenets of the Quiet the Die podcast is like master your health by listening to yourself. Do you think that there's healing in just listening to your symptoms? Is there a benefit to just hearing what your body's communicating with you?
Totally. And that's the goal, right? Because like I said, the work happens between sessions for people. So the work is developing a skill set. It's almost like working on a muscle, developing a skill set around, okay, I've got a migraine or restless leg syndrome. What does that feel like in my body? And we've talked about this on our anxiety proof program, that the unfortunate reality is the only way out is through, right? If we're going to try to say, okay, I feel awful right now, please make that go away. Please make that go away. We can apply that to pain or anything else. Yeah. It just solidifies and makes it stick harder. Whereas if we can teach people, and we can apply this to diet and intuitive eating and all these sorts of things, if we can just teach people to, when they notice that, first of all, noticing it is the first step. Oh, this is happening in my body. When they notice that, just to track it, without the intention of making it go away. The intention is to notice it, give it space, allow it to be heard. That sounds very, floofy out there, but that's basically what we're trying to do. And then that symptom, that manifestation of something else that happened has an opportunity to release itself, because, I'll say it over and over, the body's primary intent is to always keep us safe and move us in the direction of our vibrant health. It can't always do that because of overwhelming circumstances.
Oh, I felt emotional when you said it can't always do that, because it wants to. And we want to let our bodies do that. Yeah. Absolutely. We love our bodies and we want them to be able to do that for us and with us. And I think that, everyone will have heard in the last anxiety episode we did, again, about like the power of listening to yourself. You're really putting the science behind the words, which helps me too, to reinforce these ideas, which is that just your body knowing that you're listening is in and of itself a healing activity, which is really, I think, so powerful for people to understand. Now, it's not always easy to listen to ourselves. And when I think of like what people generally think of anxiety, we think like, just stop it and relax. And we know how instigating that can be for our nervous system, honestly. Our body reacts with more fear and panic when we engage like that. I want to also, take that and actually walk it back, of course. I always have to walk it back. We didn't even do a good definition of anxiety versus stress versus trauma. The reason I want to do that is because I have so many clients who say, Michelle, I've had a very good life. Like, there's no stress part of this thing. I work 50 hours a week, but like I handle it. And on a conscious level, they are handling their stress. They're flexing their resilience to their knowledge. Can we define these things and then talk about like, what are you allowed to believe for yourself is worthy of being something that could have stuck with you? Like, how do we know what's worthy of that?
Yeah. Well, first of all, I think many of us, myself included, we sort of start to wear stress as like a badge of honor these days.
Especially in New York.
Oh, let me tell you about how much I have on my plate. Exactly. Let me tell you about the choices that I've made that make this very difficult today. So that's one thing is stress is more accessible for people. It seems like stress is synonymous with achievement in many ways, especially in New York City, of course. Yeah. And I find in men in particular, but even in women, that stress is, again, more accessible. And so we can talk about their stress. Sometimes I'll use the word stress as a replacement for both of those.
Yeah.
I won't even talk about their anxiety.
It feels like it's not also like in reality, it feels like it's not a mental illness, which in our society we stratify things into categories.
It's external.
Yeah, and it feels like stress is something that you're almost quote unquote allowed to have, but anxiety means you're quote unquote mentally ill, and trauma means you're quote unquote broken. Exactly, something like that. Yeah.
I think the way I would describe it, and these definitions all blend on themselves. I would describe stress the way we did. It's sort of something external to us that we have to deal with. It's what we describe in one word as our perception of the difficulties in our life. Trauma is generally more time-stamped. There's experiences they can have. You can be in a chronic state of chronic tonic immobility, like I mentioned earlier, but trauma is some experience that was overwhelming for the body's nervous system at that time, either because it happened too quickly or because we didn't have the resources we needed or the skill set we needed to deal with it at that time. That trauma can be biochemical. Burning your hand is a trauma to the body. It can be psychosocial. It can be relational. It can be physical. Examples of a car crash or something like that. Anxiety, I would say, is the downstream manifestation of that. In some ways, just like with physical pain, it is the body quite literally screaming out in something is misaligned with my personal unique needs. So that's, again, there's a lot of blurred lines there, but that would be the best sort of framework I can come up with.
I think for anxiety specifically, it's often like, I think of anxiety as the absence of listening to oneself. So it's like almost the absence of an emotion. So if you have an unexpressed physical or emotional feeling and it's unexpressed, it's usually translated as anxiety because your body's trying to get your attention a little bit harder. And I noticed that. So I'm going to do something that I wasn't even thinking I was going to do, which is tell a part of our story too, which is that I came to you and when I was like halfway through what ended up being a terrible relationship, but was not at the time. I had a lot of mysterious symptoms, and I know some of them were related to my drastic weight loss, and we knew there was a homeostasis issue for sure that was driving the anxiety. But there was like what I would call like an environmental mismatch that I couldn't figure out essentially. So we had been doing tremendous nervous system work. You know, you were doing the M wave before it was cool. Like we were doing HRV training. We were doing really awesome stuff, supplements to support the nervous system. And then when the breakup happened, and it was like a big event when the breakup happened, maybe like a little T, big T, whatever we want to call it. And I came to you and I remember you saying like, I'm really glad we've put in like a year, 2 years of work on your nervous system because now your body will be able to like respond better and build. I had just more resilience built because of what we had done. You were like, in total honesty, it wouldn't have been good if you came at the beginning because my nervous system was so dysregulated when I first, came to work with you. So there is also something to be said for you can build your stores of your stress threshold and you can build your stores of resilience and then might be able to process some stressors or trauma more effortlessly. Can you speak to that at all too? And thanks for that, by the way, saving my life, that whole thing.
I mean, the human body is incredibly resilient. See, but first, before we do that, I thought you were going to talk about when I was offering you acupuncture, like 6 months before that, and you were like, "Am I going to feel high from this?"
Well, so this
what did I say? Would it be weird for you to feel? Would it be terrible for you to feel something?
You're not doing the story justice. Okay,
so
let me just insult you.
You're the comedian.
Exactly. Yeah, exactly. So I went to you, and I remember. So part of my anxiety manifested as fear of anything that could feel different from what I was experiencing. So when I was offered anxiety medication from doctors, I'm like, are you crazy? I'm so anxious. I can't take anxiety medication. I'm scared of them. So part of my healing process was also finding safety in things that I felt were new or might even feel good. It did not feel good and safe to feel good. So before our first acupuncture session, first of all, we negotiated for the size of the needle. Like I was like, smaller needles, smaller needles, smaller needles. And I'm not a person who's afraid of needles. It was because I didn't want it to work. That was the fear. Right. And I said, is this going to make me feel high? Is this going to make me feel weird? And you were like, would the worst thing in the world be for you to feel good? And I was like, yes, obviously that would be the worst thing in the world. That was a big joke of ours to this day, but a super transformative part in my journey because I had realized I was working so hard to feel less bad, but I hadn't even considered feeling good. And I ended up loving acupuncture and it ended up being super supportive for me. But let's take that for a second. And then what do people fear feeling good? What is the deal with that? Why did I feel that way?
I'd reframe that a little bit from the perspective of there's this concept of sort of secondary gain. And so we talk, I think chronic pain is a good example of that. Or I've had patients actually in a hypnotherapy session, we'll ask these questions of the subconscious. And one of the questions is, would it be okay for you to feel better, for you to be out of pain? Or put on sort of on the flip side is, does your pain serve you in some way? And more often than I'd like to hear, the answer is yes, right? The pain allows them to not face their other stuff because we can focus on the pain. It's understandable. People get it. You can talk about it. I'm a person who has pain. I'm a person who suffers. So yeah, absolutely.
There's an identity piece to it for people. This is another example I want to ask you about because I know you have an answer to this and I want you to explain it to people. So what will happen is if I have a client who has a tremendous amount of physical issues going on, and maybe it's gut issues or anxiety, and those issues kind of go away, this really interesting thing happens where they'll start talking and thinking about weight loss or these kind of like smaller bite things that I'm like, what are you, obsessing over food or something. And I'm like, why are you even, this is so not in your, like in the conversations we have or in our relationship. It's so interesting that these thoughts are coming up for you. Why is it sometimes when we resolve a big thing that little kind of more annoying things start coming up for us? Like what is that about?
The way it usually happens is you'll do a check-in 3 or 6 months later and you'll be like, well, how is your debilitating chest pain? And they're like, oh, I totally forgot about that. What are you talking about? I'm here to talk to you about, my migraine once a week. That happens. That's for a lot of reasons it happens. Though some of the more esoteric explanations would be, I'm going to keep repeating this. The body is always trying to keep us safe, right? And that takes a lot of energy. That takes a lot of attention on the part of the nervous system, on the immune system, on all aspects of our physiology and our biochemistry. Once that work is no longer done, that attention can go elsewhere. Put another way, so in the naturopathic medicine world, we talk about the vis, the body's innate capacity for self-healing, the vis medicatrix naturae, the healing power of nature. We can call it a lot of things. But that vis needs to have an opportunity to move us in the direction of healing. When we are stuck in some physical condition or emotional condition, it's all there. It's all focused there. Again, much more of an esoteric way to describe it. But when we have the opportunity to shine a light somewhere else, we notice that thing that we're shining the light on. Whereas before, we couldn't notice it because we were all in our anxiety, our IBS, our pain, whatever other symptom we're dealing with.
If regarding that set point of stress, let's call it, I think also it's like a hard jump to go from like super tremendous amount of discomfort and pain to then have like nothing. Maybe it's also like easier for people to create a new stress to kind of get them back. Maybe it's defending the higher level of stress. It could be, I don't know, is that a component of it too?
Yeah. I think the reality is this happens if you see 1,000 people, it's going to happen in 1,000 different ways.
100%.
So certainly that's possible.
Yeah, exactly. I just noticed that, again, I don't like when people use the phrase addicted to stress, but there's definitely a perpetuating component to stress where it's like, even when we're working with people to alter like HPA axis, cortisol, anything like that, like the level that they're, the level that people are operating at and that pattern tends to continue. So if someone's waking up at like 2 a.m., unless you're doing something to intentionally change that, our body stays in that level of stress basically. So you have to actually do things to potentiate change.
Yeah. Think about what happened at that waking up at 2 a.m. The body woke up and said, oh, I'm still alive. I'm still here. The thing that caused me to wake up didn't kill me. I'm going to keep doing this because it worked, because I'm still alive and I'm still safe.
So it proved to your nervous system that it was the right thing to do. Yeah, absolutely. So
Yeah.
you almost have to prove, like you said, create a new model that this is safe and good too, to not wake up at 2 a.m. and to show your body how to do that. How do people do that? How do we show our body that it's okay to be safe, short of course, working with a practitioner, which we're going to talk about? Is there anything people can do at home to start to increase that kind of zone of safety outwards in their lives?
So quite literally anything that is aligned with our body's needs can be helpful. So eating a more nutritious diet, getting deeper sleep. Now, these are all challenges in and of themselves, and sometimes they need extra support. But the point is, you don't have to jump right into, when I was 5 years old, this thing happened to me. You can pull back and say, what's the smallest thing I can do right now? Can I go for a 10-minute walk after, I wake up in the morning and get some early morning sun, which is going to reset my circadian rhythm, which is going to allow me to tell my body that we're here, we're safe, we're here, and we're connected to the greater whole. Certainly that can be helpful. Any change that you can make is going to move you in that direction. Similarly, from a psychosocial standpoint, one of the last steps in trauma healing is this concept of co-regulation, of going out into the world and having the social support that you need to feel safe, right? We're tribal by nature. You and I have spoken about this in other ways. When those small experiences, and they're not small for the person who's never slept well in their life, that's certainly a huge thing. When those things build up in a cumulative way, you can then look back and say, I have the resilience, to answer your question earlier.
Right.
My tank is full enough to then go face this other thing. What I would offer is, short of that, the mother I mentioned in the example who just is stretched too thin, it's not the right time to do trauma work.
There's a season for it.
There's
too.
a season for it in life, like anything else. So let's get you focused on eating a diet that is aligned with your body's unique needs. Let's focus on changing your relationship with food, certainly.
Mm-hmm.
Let's focus on the sleep or the movement. Let's focus on giving you 30 minutes a day that is just for you. Let's just start there.
Absolutely.
And that's often the first place you have to start, because you can give people a 2-page protocol and all these changes that they want to make. It's not going to help them if it's on a piece of paper that they can't incorporate into their lives. So.
And it's certainly not going to help them stress-wise if it's adding more stress to their bucket,
Yeah,
essentially, and
exactly.
so to speak. When it comes to, and this is a question that I forgot to go back to before, but is there like a level of trauma? Because again, this is something I get from clients all the time, and some mutual clients of ours, so the person who's listening to this is going to laugh when they hear this. People who say, I had a great life. I don't have trauma. This is not influencing my pain. This is not it. Like, how much trauma does it have to be? I know that's not a real question, but how do we get people to understand that even things that felt maybe small may have imprinted and maybe something that, it got sticky with them?
Yeah. I guess the question for anyone is, are you suffering right now? Then probably the answer is yes. Because it doesn't have to be those things that you would read a biography about, right? It's not something that would be the core chapter in a memoir. It can be, let's take it to the first days of life. There's attachment issues that happen, right? And so think about any older sibling, maybe a couple of years removed from a younger sibling, that first day that you look at your mother and your mother rightfully has to attend to the needs of the baby, that's annihilation in the nervous system. So right there, that's trauma. We all experience it. It's a common experience. So without putting value judgments on this thing happened to you and you handled it and this thing happened to you and you didn't handle it, what we have to look at is, where are you now? Are you suffering? Have we addressed all the physical reasons, right? Again, we have to walk both paths. If we've done that, then there's probably something else there and that needs to be faced. And the only way to face it is through listening to the sensations that the body is quite literally speaking out with.
In ways of trauma being this thing that we think of it as like like more of a symptom than a sign, as in we view it as more of something that is totally unseen and doesn't really exist short of inside of our heads. What's the like cellular impact of trauma? Like if you had a big T, let's call it, what would be happening inside of your body physiologically during that?
Well, it's some of the things we mentioned earlier. Inflammatory cascades go on. Think about it from the perspective of that bear that's chasing you. What do you need to do to protect yourself? You need to pump muscles pump muscles.
All right.
You need to pump your muscles. You
All right,
need
fitness bro. All right.
You need to pump blood to your muscles, to your heart, to your eyes. Get out of there, fight, get big, whatever you need to do. That happens at the expense of all of our vital organs. You're not going to be running away from that bear and digesting your food. You're not going to be running away from that bear and processing things through your liver as effectively. That all happens, right? Because we would die if it didn't happen. But it happens to a degree, to a scale that's not supportive of healing. Now, you multiply that every day for 40 years, and that's going to have physical impacts, right? On a nervous system level, we already talked about the autonomic nervous system. On a hormonal level, what we're looking at is the hypothalamic pituitary adrenal axis, cortisol, adrenaline, noradrenaline. People who are chronically stressed end up depleting their serotonin, also their norepinephrine. That ends up manifesting in gut health and all that. So the right way to answer that question is to take a look at each individual symptoms and try to understand the story and then work backwards to deduce, okay, this is the pattern that's going on here.
And I keep making you answer the same question in different ways because I want to keep reminding people how important that when something's happening, your brain isn't cut off from the rest of your body. The rest of your body is intricately connected to your brain, and all of your body is working, like you said, always to save your life and make you happy. Your body's working really hard to do that. So it's what's happening in the moment that's important for people on a biochemical level, let's say. And then, like you said before, the imprint of what that is in that our body remembers what happened and our body learned from what happened. We're like AI kind of, you know, like where our body's like constantly, which is like scary, ChatGPT, wow. But it's our body's constantly learning from experiences to further save us. So if you keep having experiences where you're overexposed like that, and then you can continue to imprint again and get into these new set points of stress. So I'm just pulling together these ideas that we've been talking about for sure.
I'm just thinking about in a year. So we're filming this in beginning of 2023. In a year, when someone's listening to this, they're going to laugh at your GPT.
It's like it's going to cost $500 a month at that point, by the way.
It's just going to be, what are you talking about? There's so many other applications. and
I hope people are still listening to it in years to come. That'll be so nice.
Sure. Hopefully the AI overlords are going to actually support.
Don't say the AI overlords. It's just Elon Musk. It's his
the
thing,
algorithms are going to put your podcast on top.
I do always call like Jeff Bezos like our father, basically. He's like the overlords of our lives. Like,
super weird, Michelle.
True. By the way, yes. So also laughter, what a medicine for trauma and healing, right? So much so. So we really covered like the basic things, again, of what's going on inside of the body during stress and trauma, about tiny things we can do. Let's talk about in a practitioner's office. I just like to talk about what somatic experiencing is, because this is something that is part of your trauma-informed lens of naturopathic care. Can we talk about somatic experiencing?
As a specific modality?
Yeah.
So it's one among many body-focused approaches. None of them are necessarily better or worse, but what I really liked about somatic experiencing when I first started learning it is how systematically applicable it becomes. It's about how you think about the nervous system in relation to experience. And in a way, it's helping people to understand that they can face their experience as long as it's in a sort of a maximum tolerable dose. And so that's the work, is going back to something that happened, or in the moment as you're talking about it, say with your therapist, feeling into your body and noticing, okay, this is what I'm feeling and this is what I'm feeling, but then making two key changes. One is slowing the experience down. Things happen so quickly, and the nervous system really needs an opportunity to process things out. To slow things down and to feel resourced enough to deal with it. That resource can be having other people around who are supportive of you. Obviously, we're not doing that in a session. That resource can be new understanding that you didn't have at that point in your life that can be applied. So in somatic experiencing, there's this concept of addressing what's called SIBAM, so sensation, image, behavior, affect, so anxiety, depression, mood, whatever, and then meaning. And so you have to look at all of that within the context of that experience. What ends up happening, if done well, is the nervous system has maybe the first time, for the first time, an opportunity to discharge some of what it's been holding for so long. And that's really where it gets fun, is people say, this thing that I've been feeling, I haven't known that I've been feeling, it's been there for 20 years, and I actually feel it leaving my body. It can happen in a lot of different ways. Now, that doesn't happen in one session. Sometimes it can, but it's really about... Popping it wouldn't be a good thing.
No, it would not.
It's about giving the body an opportunity to do it at the pace that it needs.
There's also this sensation I'm getting of like the body is holding on to something. It almost feels like it's carrying something physically within us, and we know that, again, we feel that release. We feel our shoulders, unclenching. Is there something happening in trauma too, where is there like cellular damage or something that's physical that could ever be measured or seen, just out of interest?
Well, the most obvious thing for people is the experience of muscle tension. That's probably the most accessible for people, right? And so the idea of carrying something around, or people will say just the most amazing, spontaneous things. First of all, the person you think would never have access to these emotions or these words talks about, I think I've had armor over my chest for the last 15 years after this thing happened, or I feel like there's been something making my body contract as the opposite of expansion and sort of opening up to the world, making my body contract and crunch to get small. I feel small right now when I think about this experience.
Almost like you're hiding, like you're getting smaller. Yeah.
And you can't just tell them, okay, open up, right? That's too cognitive. It's too conceptual. The body has to get there in a way that's in slow drips. There's this concept of titration, so giving the minimum dose that the person needs. And there's also another concept if we're talking about somatic experiencing, which, by the way, is not my work, importantly. Dr. Peter Levine started this work in his observations of how animals in the wild dealt with their experiences of trauma. So a lot of really interesting work around that. But there's this other concept from Dr. Levine of pendulation. Pendulation is this idea that we can't just chronically sit in that difficult emotion. So we have to go towards resource. Maybe there's something in the room. Maybe I like to look out the window and there's a tree and there's a bird there. That helps me to recalibrate, and then I come back into the trauma. You go back and forth. You go back and forth, and that's how that discharge happens.
This is, so just to even walk it back even further, that's what I do. Somatic experiencing is a modality that people use. It's a style, it's a practice, it's a certification for people to help support trauma healing, and where you are literally sitting in a session and going through distinct memories and then applying a certain lens to them, and the practitioner is very safely guiding you through and kind of like connecting the somatic, like the physical self, with the mind, and kind of recreating those experiences in a way that's more favorable biologically, would you say? You can redefine it.
So the person's doing all of that work themselves.
Yeah, people don't even know what is happening in a literal session. So that's like what it would look
so
like.
Yeah, so you're just hopefully being a gentle guide. It's not very directive. You're sort of following what's happening. I would say it's almost like, people who guide people on psilocybin trips or LSD trips. It's very similar. You help them understand that it's okay to face this. It's okay to go towards it, but I'll be here with you. You're not doing it alone. And even that sort of co-regulation, that relational aspect is very helpful. There's a lot of interesting research in terms of therapy that it's more about the relationship with the therapist than the technique that's used. So it's very similar in that way. But that is what's happening. You're walking alongside them on their journey towards whatever wholeness they're looking for.
It's just that I think it's just important for people to know that in addition to their incredible talk therapy they're doing, there are like more additional modalities they can explore too. And I know this is one that obviously you believe in and are, invested in, let's say, in ways of what people can do right now if they're feeling like, I am filled with anxiety, I'm filled with stress, I'm aware there's these traumas. Of course, seeing a practitioner is a very, very viable solution. What else can they do at home? And I know we talked about some supportive strategies to increase safety, but what can they do starting now?
Yeah. And that's an important point, and especially in our modern healthcare system, most mental health work isn't covered by insurance. Mm-hmm. So people pay all this money for insurance every month, and then they can't even go get the care they need. So that's a very crucial and important reality. If there was one thing that people had to do, just focus on changing your breath. Because our breathing patterns, if we talk about where can we empower ourselves and where can we have control, our breathing patterns are the only aspect of our physiology that can be fully under voluntary or involuntary control. You don't have to think to breathe. Your body does it. However, your nervous system and the connection between your heart and your brain in particular, as it relates to the respiratory system, your nervous system is always paying attention to and listening to the signals that we're sending in. So in slowing our breath, usually the cadence that you're looking for is about 6 breaths per minute. So you're doing, a 10-second sort of cycle per breath. 5-5, box breathing, 4-2-6, whatever people like to use. The key is that you want your out breath to be just a little bit longer than the in breath. The exhalation just a little bit longer. You want to take a slow in breath. I like to use the 4-2-6, 4 seconds in, 2-second hold. These are real seconds. These are 1 Mississippi, 2 Mississippi, and then a 6-second out breath. Slow and steady exhalation. What that allows is to quiet that autonomic nervous system, which is one of those signals of safety to the body. What I'd encourage people to do is the next time you have a difficult conversation with someone who tends to be difficult in your life, do some breathing before that for 3 or 4 minutes. Focus on that breath moving in and out through the center of your chest, or some kind of conception of coming into your body when you do it. I can almost guarantee that conversation will be easier. It's still not fully in your control, and it might be quite difficult, but you'll be more grounded and coming at it in a clearer way. So that would be probably the air is free.
Love it.
For now.
The air is free. And I think that, again, I like that everything we talk about always brings the power back to, in this case, the listener, if you're listening to this, because it's not to say that, sure, on one hand, we're saying we've encountered a tremendous amount of stressors. All of these biochemical reactions are happening. We've all encountered a lot of trauma, but something as simple as taking 1 minute to breathe can actually build your stress resilience so that when you encounter these issues, your body can respond in a more effective way for you that will hopefully result in less symptoms and everything like that too. So it's not, there's like a million things you can do. You can eat regularly. Managing your blood sugar even can help create feelings of safety. Reducing inflammation in the body can do that. Like anything that you're doing to intentionally support yourself, regardless of modality, is healing in and of itself too. So I think there's a platter of options for people to reduce their stress and anxiety, or again, gently confronting trauma by at home increasing your resilience. And no matter what comes at you, if you can increase your resilience, you can handle it maybe even 10% better, the next time, or whatever that looks like for the person.
And that is a milestone. It's a stepping stone on the path in that direction. So it's not that it's an end goal in itself. It's nice to feel better, but it also is one of those signals of safety, examples of safety for the nervous system to then make the next time a little bit easier. We change our physiologic set point in that way.
Yeah, the set point and the AI are hot topics of this conversation, which is that the fact that our body is constantly learning from experience, and though it can learn from a traumatic experience to respond with fear or to respond with, nervousness and so those sensations of anxiety, we can also teach our nervous system to respond with strength and to respond or with more strength and more resilience to things. So that's very cool. If we can train ourselves to experience these traumas, and we can train ourselves to experience them a little bit better too.
Yeah. I think the other way to think about this is that the body is what's known as a complex adaptive system. It's always moving us in the direction of that homeostasis that you mentioned earlier. The symptoms that we manifest in that moment are often the work of the body to heal itself. So suppressing them actually causes a deepening of those challenges.
We hate the only way out is through, but it's true. It's just, I know.
It's just overused, but
yeah, exactly. True. It is. Right. Which is that there is in all of this, and the one last thing I'll add is that there is like a discomfort level that has to be achieved sometimes for us to get to the other side of comfort, which really stinks. And I also wish wasn't true, but it seems to be. Yeah. And it's really hard to say that to people who have been chronically ill or in pain for a long time. And that's like a lot of our clients and patients. It's hard to say like, well, you're not uncomfortable enough. That's really not what we mean when we say that. Right. They're the most uncomfortable. Like they experience and are actually quite resilient as people to tolerate it. But it's this balance of knowing when to allow and when to fight and what to tolerate and what honestly not to tolerate sometimes too.
And I think that's an important place to also say that often when these sorts of conversations are had, if they're not had in a way that's clear for the person who's suffering, what it sounds like is, oh, this is all in your head. Yeah, no, I hate that. And the important point is it's very much not.
Or willpower. Like you should just fight through it.
Just grin and bear it. The concept is more so that even if it started from some experience that your body has, and even if it's experienced in your head, it is manifesting in your physical body.
Exactly. Yeah.
And so it's not to say you're depressed, you need an antidepressant. That's the translation of it's all in your head. It's both. It's always in your head. It's always in your body because they're inseparable. And so I really want to make that point very clear.
I'm going to, like many other episodes, I'm going to wrap us in with a Harry Potter quote, if you don't mind, which is that Harry asked Dumbledore, is this all happening inside my head? And then he says, is this real or is this all happening inside my head? And Dumbledore says, of course it's happening inside of your head, Harry. But why on earth should that mean that it's not real? So I know, so good, right? That great. Really wrapped us up. I know our videographer, Stefan, Birch Media, he's smiling a lot at that. He loved the Harry Potter quote. Dr. Rob, Dr. Kachko, my dear darling friend, where can people find you if they want to work with you? How can they work with you? Tell us.
So the easiest way probably is to just go on our website. for multiple clinics. New York Center for Integrative Medicine is in New York. We also have a similar clinic in Stamford, Connecticut. So the New York tri-state area, Connecticut area, we're here for you. If you go to www.nycintegrative.com, you can
I'll
schedule.
put your link in the show notes.
Perfect. You can schedule a discovery call. We don't charge for those. We want to just make sure that people have an opportunity to describe their story to make sure that we can help them in the right way. So we're here for you.
If also you're planning on having a terrible breakup, I'd say go to Dr. Kachko a year before, get that resilience up. Just, if you're planning, get yourself set up for it. This is going to be your new clientele.
Yeah. We'll do our best to not make that a self-fulfilling prophecy a year later.
Exactly. Thank you so much.
Thank you for having me.